Welcome to EJOIS Academy. I am Sabna, lab faculty from EJOIS. If you are planning to attend an overseas exams like DHA, DOH or Prometric for the lab technologist, then this is the correct video for you. In this video, I am giving a demo class of our application program, and this application program is very easy to use, and we are providing these type of programs in nurses, pharmacy and other courses also. In this program or in this application, you can use this class or you can use this application anywhere, anytime at your convenience. That is the specialty of our program. So, for the details of this program and these classes, you can contact the number that is given below. And I am going to take the class without any delay. So, our topic is Glanzmann thrombosthenia. Glanzmann thrombosthenia is a coagulation disorder. It is due to the defect in platelet. So, when we are going to study about this, the Glanzmann thrombosthenia is a qualitative platelet disorder. That means the qualitative platelet disorder means there is the problem with the quality of the platelet. The platelet disorders can be mainly classified as quality platelet disorders and quantitative platelet disorder. The quality means there is a defect in the platelet structure, and quantitative means there is the decreasing or increase in the number of the platelet. Okay, so Glanzmann thrombosthenia is a qualitative disorder, and it is an inherited autosomal recessive condition that is mainly seen in females. And the main defect in this disease is there is a deficiency or defect of the surface receptor glycoprotein 2B3A. Maybe glycoprotein 2B and 3A. These will be defect or deficiency leads to the disease. So, glycoprotein 2B, 3A play a major role in the fibrin linkage and aggregation of the platelet. Aggregation of the platelet will be not occur in this disease. That's the main condition here happening. So, the defect in GP2B and 3A complex leads to the defective platelet aggregation and subsequent bleeding. So, in this picture, you can see this is the GP2B3A in a resting form. When it is activated, it will open up and link with the fibrinogen, and it will leads to the aggregation of platelet, and this aggregation can lead to the clumping and the subsequent clotting pathway, or that leads to the formation of clot and stopping of the bleeding. If it is not happening, then there should be no the stopping of bleeding occurs, it will be continued. So that is the deficiency in this disease. The platelet aggregation is not taking place in Glanzmann thrombosthenia. So Glanzmann thrombosthenia has three categories of severity. That means depending upon the level of platelet deficiency or the count of the receptor, it is classified into two forms, type 1, type 2 and type 3. The type 1 is the most severe case. Here only 5% of platelets are normal, or less than 5% of platelets are normal. That means the only 5% of Glanzmann 2B3A surface receptors are normal. And in type 2, less severe, here 5 to 20% of them are normal. And type 3, the variant of thrombosthenia with level more than 50% of normal, but with the major abnormalities in the way of platelet aggregates. Here the platelet number will be high, and then defect will be 50%, but the aggregation abnormalities can be seen in these conditions also. So you have to know in Glanzmann thrombosthenia the main problem is the aggregation. So the platelet count will be normal and the structure mostly normal. The main problem is with the function of the platelet. Okay, the function of the platelet is difficult, or the function of the platelet is abnormal. So, when we are going for the symptoms mainly purpura, menorrhagia, mucosal bleeding, brain hemorrhage, epistaxis, gingival bleeding, gastrointestinal bleeding, postpartum bleeding, increased bleeding post-operatively. So, the main situation here is happening that the bleeding is not stopping. If the tooth eruption is happening in kids, the bleeding will not be stopped. If any small cut is happening in their arms or any other areas, the bleeding will not be subside fastly, and nose bleeding is almost seen, that is the epistaxis. And if the first time of menstrual bleeding, and it will be not stopping, the bleeding will be heavy, and these are the main symptoms occurs in kids. And the infants, in infants, you can see in leukocytosis, delayed separation of umbilical cord, purpura, spontaneous bruising, mucocutaneous bleeding. The main content you can see, the main thing there is a mucocutaneous bleeding and menstrual bleeding, gingival bleeding, and epistaxis. So, when we are looking for the lab diagnosis, the bleeding time is prolonged. The platelet count will be normal, platelet morphology will be normal, and PT, prothrombin time, and PTT will be within reference range. The main area, the main problem will be in the bleeding time. Bleeding time will be prolonged. And when you're looking for urine analysis, you can see proteinuria and microscopic hematuria. These are due to some types of internal bleeding. If the internal bleeding is happening in our body, there is a chance for hematuria and proteinuria. Then next is when we are doing the electrophoresis of the protein, you can see the absence of the GP2B and 3A proteins. So the normal platelet count and morphology should be normal, and prolonged bleeding time you can see, and abnormal throat retraction, not the point, abnormal throat retraction you can see. Then when we are looking for the platelet aggregation assay, the platelet aggregation assay, we are using ADP, collagen, and epinephrine, restositin. Here in Glanzmann thrombocythemia disease, the restositin should be normal and others will be abnormal, and there should not any response. That is the main thing, or that's the differentiation for the Glanzmann thrombocythemia disorder. The main thing is that restositin in platelet aggregation assay, restositin should be normal and others should be ADP, collagen, and epinephrines are giving no response to the test. And also the flow cytometry and light transmission aggregometry (LTA) are the advanced laboratory tests. In flow cytometry, there is the deficiency of CD41 and CD61. This CD41 is glycoprotein 2B and CD61 is glycoprotein 3A. So this should be deficient in the flow cytometry, or there is a defect in this cluster of cells. Okay. In light transmission aggregometry, we can also see this is the advanced level of diagnostic for this Glanzmann thrombocythemia. And this is about the Glanzmann thrombocythemia. The main thing is that is a qualitative platelet disorder. Bleeding is the main thing, and the platelet should be normal, and platelet morphology is normal, but the function is abnormal. That is the main thing is happening in this disease. So the treatment is not very important, but you have to know what is the treatment. That's only. The dental hygiene with the decreasing the gingival bleeding, and awareness of antiplatelet agents and antifibrinolytic drugs, and in type 1 severe, like heavy severe conditions, you can use the platelet transfusion and hemopoietic stem cell transplantation. Now we can look for the questions, type of questions that is asking for the exam from this topic. Which set of the platelet response would be most likely associated with the Glanzmann thrombocythemia? The options are normal platelet aggregation to ADP, restositin decreased aggregation to the collagen. Normal platelet aggregation to collagen, decreased aggregation to ADP and restositin. Normal platelet aggregation to restositin, decreased aggregation collagen, ADP and epinephrine. And the answer is C. Normal platelet aggregation to the restosine and decreased aggregation to collagen, ADP or epinephrine. This is the answer. Then the next question. A throat retraction defect is suspected in a newborn male experiencing severe bleeding following circumcision, and the following results are obtained. These are the characters of bleeding time. It is great, and platelet normal response to restositin. When you are having a report with a normal response to aggregation, normal response to restositin, and others are weak response and the bleeding time is high, the disease indicating it is Glanzmann thrombocythemia. That's the thing you have to remember when you are studying about this disease. And that's up to the Glanzmann thrombocythemia. Okay, thank you.